As of right now, our policies have not changed despite the Florida judge overturning the U.S. government mandate.
You still need to mask up if you want to sit down on a STARS bus. Lauren Pawlowski is the Chief Financial Officer and Deputy Director at Saginaw Transit Authority. Pawlowski tells us she's paying attention to the positive COVID case count in the Saginaw area. And even though the numbers are down, STARS isn't at a point to give up the masks yet.
We are very cautious of that. However, we've also seen spikes after holiday weekends. And with Easter just happening around the corner, we're hoping to see a different trend than what we've seen in the past.
According to the Michigan Department of Health and Human Services, COVID cases are expected to increase across Michigan thanks to the BA2 subvariant.
A slower and steadier incline when it comes to cases than we have seen with previous surges, but we're expecting a rise in cases continuing on through the beginning of May.
Natasha Bagdasarian is the Chief Medical Executive for the State Health Department. Bagdasarian says not to expect anything like the Omicron surge earlier this year. She also tells us the BA2 subvariant, while more transmissible, doesn't appear to be more severe than previous variants.
We may see sharp spikes in the future. There may be new variants of concern. We may see a spike again in the fall or in the winter. So having a COVID plan is really key.
Pawlowski tells TV5 the Saginaw Transit System has several ways to reduce risks for riders, including masks and hand sanitizer. And each vehicle is also equipped with an air exchange system.
With the strains of viruses out there, we want to make sure that with the mask, it's that extra level of protection.
James Felton, WNEM, TV5.
The CDC wants the Justice Department to appeal the ruling that got rid of the travel mask mandate, setting the country up in a legal showdown. In a statement, the CDC defended the mask mandate, saying, quote, "At this time, an order requiring masking in the indoor transportation corridor remains necessary for the public health."